Erb's palsy in children. Erb's palsy is a condition that results from nerve injury to the upper plexus involving the nerves that control muscles in the shoulders, arms, or hands. According to ubpn.org, brainandspinalcord.org, Erb's palsy can be caused by several things which can happen during a difficult delivery. Approximately 1 or 2 babies per 1,000 births will have a brachial nerve injury. The brachial nerves can be injured if the baby's neck and head are drawn to the side when the shoulders exit the birth canal. Pulling excessively on the shoulders as the baby comes out head first can also lead to a brachial nerve injury. During a breech birth, which means the feet are first, the arms are usually raised and may be injured from excess pressure. Most cases of Erb's palsy are due to stretching of the nerve and will heal within 6 to 12 months of delivery. Stretching shocks the nerve, but rarely leaves permanent damage. Occasionally, a stretch injury will cause scar tissue to form around healthy nerves. In this case, recovery may not be total. Cases in which the nerves are torn are the most serious and will not completely heal on their own. In rare instances, the nerve is actually torn apart from the spinal cord. This is called an avulsion. It is estimated that fewer than 10% of brachial plexus birth injuries result in permanent paralysis or impairment. In cases of simple stretch injury or mild tear, Erb's palsy will heal on its own. But the baby should receive physical therapy so that the arm does not stiffen. Gentle massage and range of motion therapy are used to keep the muscles strong and the joint from becoming contracted. More extensive nerve damage may require surgery. If the nerves cannot function properly, tendon transplants are sometimes used. Such options are generally not discussed until the child is 3 to 6 months old. Even with surgery, nerve injuries heal very slowly, and it may take 2 years or more for a complete recovery. In some cases, the affected arm will always be weak, the range of motion will always be limited. According to Outreach magazine, as well as traditional physical therapy, there are other treatments known to work well for patients. Hydro or aquatherapy in a heated pool is an excellent way to loosen and stretch muscles. The heat and the hydrostatic pressure of the water offer great benefits to the patient. Massage therapy and chiropractic treatment bring relief to many patients. Any muscle motor recovery from paralyzed muscles will need strengthening work for a long time after reintervention. It is important that the patient develops a long-term view of brachial plexus injury rehabilitation. Most brachial plexus injuries result in a completely flail arm immediately after the injury happens, with little or no movement detectable. As recovery occurs, the sensation and motor functions of the affected limb may gradually return. Some injuries are less severe and virtually complete recovery may occur in these cases. I also read a book called One Soldier's Story by HarperCollins. This is a book about a soldier who went off to war with this condition and his amazing recovery and how he treated himself during the war and during his battle. I really enjoyed reading this book and studying this disease. It is very amazing to me that the children who have this and go through this every day of their life are not miserable. They are some of the most happiest people I have ever met, and I really enjoyed reading their stories. A personal friend of mine has a little son who has this condition, and he is one of the most happiest people I have ever seen in my life, and I'm so grateful that I have the opportunity to have him in my life. Thank you.